Hi guys, so we're looking at the pharmacology of the next antibiotics. Alright. So this antibiotics is what is known as what? Amoxicillin. Amoxicillin. See, there's a picture of amoxicillin. This is amoxicillin. This is amoxicillin. Right. So say that it's a broad spectrum antibiotics. So when you say something is broad, that means it has action on many bacteria. Okay, a broad spectrum. So how does it act? It acts by inhibiting bacterial cell wall, right? So to inhibit bacterial cell wall synthesis, so to bind to then inactivate the penicillin what binding proteins, which are useful or essential for cell wall construction. So it also has some bactericidal action, so meaning it can actually directly kill the bacteria, okay? Apart from inhibiting their cell wall growth, it can also directly kill them. So looking at this thing now, for the antibacterial spectrum, that's like the type of bacteria that I can act on. It can actually act on we have Streptococcus pyogenes, Streptococcus pneumoniae, Staphylococcus aureus. Then for gram negative, we have things like Haemophilus, influenzae, Escherichia coli, Klebsiella pneumoniae, right? Then for resistant strains, there are some bacteria, especially Staphylococcus aureus, produce beta-lactamase enzyme that can actually inactivate this amoxicillin. So the Staphylococcus aureus are actually what resistant to the drug. Okay, so that's not really good news, but still nice. Pharmacokinetics is well absorbed from the gastrointestinal tract. Then distribution is well distributed throughout the body. Metabolism is in the liver and you metabolize it to what? Inactive compounds. Excretion is primarily by the kidneys in urine. Okay. So for adverse effects, when you're taking this drug, can be expecting things like what? Nausea, vomiting, diarrhea, and all of that. Okay. Yeast infections too can actually increase the risk of yeast infection because sometimes the normal bacteria that are supposed to be there will not be there again. You get, so you have all those problems coming in. Then clinical use is used in treating what? Pharyngitis, tonsillitis, pneumonia, skin infections, otitis media, urinary tract infections. Then one of the adverse effects could be what? If it is used in combination with clavulanic acid, it can cause diarrhea. Okay. Then it can also be used in prophylaxis. That's in surgery. That's for if a patient has a risk of what? Developing, the patient has a risk of developing some infections during a surgical procedure. You use this drug basically to prevent that, right? So that's it for what? Amoxicillin.